everyone, I'm Dr. Amna Husain, board certified pediatrician, board certified lactation consultant, and mom. I'm mom to 2 girls and expecting my 3rd little one. Today we're going to be talking about when it's okay to have visitors over for your baby and what are things you have to consider. Everybody always talks about the newborn's immune system, how fragile the newborn's immune system is. And that is true because we do have to protect our newborns. If they get sick, they don't really have the same kind of reserves that we do as adults or even older infants. It can lead to a lot of serious things, serious procedures, and definitely things that we want to prevent. That's why you hear a lot of pediatricians counsel about visitors or having family over, things to keep an eye out for. Let's talk about the newborn's immune system at baseline. So what kind of immunity does a newborn get from the parent, from the mother? So prenatally, we do have some exchange of antibodies through the placenta. This is something we know, and this is why it's so important for moms to also be vaccinated against serious bacteria and viruses that can have devastating consequences. Those antibodies and that immunity can actually confer some resistance for the baby as well. This resistance won't last forever. This immunity does start to fade. So within the first few weeks to months of life, you do start to see a decline naturally from the baby's bloodstream. At the same time, we're also trying to get the newborn vaccinated. So if you can imagine, while mom's antibodies in baby's bloodstream are declining, baby's also developing their own antibodies as they're getting vaccinated, which is exactly what we want. Somewhere between all of these first few weeks and months, though, we're worried about baby's immune system as we're still trying to develop all of this immunity, right? Especially if you're breastfeeding, you might think you're able to confer some immunity that way, which is true, but it's certainly not enough for you to say that you can pass up vaccines and that this should be enough for the baby's whole life. So let's talk about what are some important aspects when considering having visitors over or people or family over when your newborn is brand new and has this immune system that's going through so many changes. First up, is it okay for you to have visitors? Now, this is very family dependent, and I will say that as a pediatrician and as a parent and soon to be a parent to another newborn, I will say that you get to reserve your judgment for close family versus extended family versus close friends or friends you may not want to see, however you choose to do so. So if you have close family and you feel comfortable with them being around the baby, I would say that's totally up to you. And if you have extended family that you don't necessarily feel comfortable with them being around the baby, or friends who aren't the best of friends that you're just not sure, don't really feel comfortable, that is okay. You reserve that right. Is it okay for them to hold the baby? I get this question pretty often, actually. And I think it's really important, especially if you have siblings. So siblings often want to hold the baby too, or kiss the baby. Generally, I try to say that there's some great spots to kiss the baby or hold the baby that may decrease the risk. So sometimes I'll have siblings hold the feet while the parents are holding the head, and then, sitting side by side. So baby is kind of sprawled on 2 laps. When it comes to kissies, try to kiss the back of the head, kiss the feet. Maybe you can kiss the elbows, the thighs, the knees, different places that kind of stay away from the hands, which can go in the mouth, the eyes, the nose, the mouth, because those are places where you commonly would think of viruses getting transferred or infections, bacteria getting transferred because they're mucosal surfaces. So if you have family visiting, can they hold the baby? Especially if they're an adult, you get to make that decision, how they hold the baby, if they hold the baby, if it's okay to kiss the baby, where they kiss the baby. But if you have siblings, that's my general pediatric guidance on safe spots to hug and kiss. Are there special immunizations that visiting family and friends should have? Actually, yes, this is a really important point and something super important to consider. So generally we ask for a Tdap booster, and this can help specifically for the pertussis component. So pertussis is a bacteria that can cause whooping cough, and it's really important. You might often hear about support partners or spouses getting vaccinated for Tdap or getting their Tdap booster. If you have any family visiting, they should also have an up-to-date Tdap booster because we're trying to prevent the passing of pertussis to baby. Other vaccines and boosters that are important to consider: flu, especially if you're in cold and flu season, and the COVID-19 booster. I think those are all really important things to consider. Now, generally, are newborns more susceptible to germs and illnesses? Well, they're more susceptible to having these germs and illnesses play huge roles in their body. And this is because things like sepsis, a bloodstream infection, or meningitis, an infection of the meninges or the lining of the brain and spinal cord, are very likely to happen and easier to happen in a baby because they have an underdeveloped blood-brain barrier. And at this time, if they catch a cold or virus, we do have to make sure we're ruling those out, especially in the initial first few weeks of baby's life. So that's why you might hear us as pediatricians talk about make sure your vaccines are up to date, make sure you're being careful about who's around the baby, make sure your hands are washed, make sure people are wearing a mask, and if they're ill, they definitely should not be around baby. Now, what about bringing baby outside to the big world, right? So can your baby go out for an outing? Now, generally, as a pediatrician, I'm going to tell you to try to avoid crowded indoor spaces, the mall, a crowded restaurant, especially at lunchtime, dinner time. Things like that, you're gonna wanna try to avoid, especially in the first 2 months of baby's life before really they've had any of those vaccines. Other things that are really important to consider is where you're going. If you're going outside, I'm typically okay with that because generally viruses, bacteria are less likely to be contracted from the air versus closed indoor places where ventilation isn't as good. I'm totally okay with you going outdoors. Just consider, time of day. If it's sunny, make sure you have some cover or shade for baby. Make sure they're dressed in comfortable clothing. Those are all really important aspects, especially when you're considering baby's first outing. All right, I hope that was helpful. If you have questions, make sure you ask them below. Generally, during cold and flu season, it is totally okay to take a more cautious approach, especially with visitors. But any time of the year, if you really feel like I'm not ready for visitors, feel free to just blame it on the pediatrician. We are totally happy to get blamed for that. Because at the end of the day, you as the parent need to be very comfortable with who is visiting your baby and holding your baby. All right, guys, have a great week. Bye.